Welcome to the Meditech Expanse Navigation Training. The format of training today, we will be doing a walkthrough demonstration of navigation. We will have a period of Q&A, and then the second part of training will be a hands-on practice where you can get into the system. For any questions, we have provided paper for those of you that are attending in person, and for those that are attending online, if you would use the chat feature, we do have someone monitoring the Zoom sessions so we can make sure your questions get answered. A little bit of housekeeping. Please keep your screens off until we get to the hands-on practice session. And then if you please don't place any orders today, we are going to be using the same patient. So that just helps with when we get to that hands-on practice. Items for completion at the end of training, we do have CME credits available. And then there is a quiz required for completion of your navigation training. Those 3 links have been sent to you via email. And please, if you have any questions about any of those 3 items, please don't hesitate to reach out. All right, with that, we will go ahead and begin Expanse navigation. In Expanse, we have a lot of new features, and one of those features is the search field functionality. We call that Googling the chart. This helps with click reduction and quickly launching you into items that you can find without having to click multiple places. With that, we also have the navigation bar that quickly allows you to launch into chart functions such as ordering, documentation, and the discharge plan. We have what's called the reference panel that stays in place regardless of where you are in the chart. This allows you to reference labs, vital signs, allergies, home meds, visit medications without ever having to leave your document or other chart functions. We have blocks of information called widgets. Widgets allow customization to bring forward patient information that is quick and helpful to you as a provider. And then finally, you're going to hear me speak about Chart Viewer. Chart Viewer allows you to simultaneously view a patient's chart in one browser tab while working on other functions in a different tab. So when signing on to Expanse as a provider, selecting Launch New Session will bring you into the Meditech login screen. Once you get to the Meditech login screen, the next screen that you will see, from your menu, you will launch into the Physician Status Board or Physician ED Tracker from the following menu items when logging into Expanse. Your screens may look different based on your access. However, I want to point out that whatever current access you have of a provider is what you will have in Expanse. With Expanse, I would like to review some of the terms that you're going to be hearing me refer to throughout the navigation training. Widgets are individual blocks or packets of related data. Tabs are buttons which allow you to open pages side by side. Icons are buttons which open overlays displaying related information. And panels are sections containing groups of similar information and or widgets. And since the system is web-based, you can use browser shortcuts. One helpful shortcut is if you use the Control plus or minus, this will zoom in or zoom out of the screens. When you open Expanse, you're going to land on the clinical homepage or the physician status board. A little bit of orientation to your physician status board. It's displayed with your patient list. In this example, I am reviewing my rounds patient list. And then next to my list, I have a number. This number just indicates how many patients are in that list that I am reviewing. Within my physician status board and my list of patients, I have the patient's room number, followed by the patient's name, age, sex, and their admit status. The next column displays the number of days since the patient's been admitted. And then underneath the number of days since the patient's been admitted is if there is a consult on the case. The next column just represents who the attending physician is. And underneath the attending physician It lets me know if the home meds have been confirmed or are not updated status. The next column is just the patient's diagnosis, followed by the patient's code status. Next to the code status is what's called the yellow sticky note. What the yellow sticky note is if I click into the yellow sticky note, this allows me to write myself a personal comment, such as check labs. Note, this comment is for personal use only. I am the only one who can see this comment, and it is not stored as part of the patient's permanent record. If I save this, I can now see this displayed on my sticky note. And then the last item in the physician status board or my clinical home screen is the lab indicator icon. You'll note that in some of these are bolded. This just tells me as a provider that there is new items in my lab indicator that I have not viewed yet since I last opened the patient's chart. Items that I will see in the lab indicator are items such as lab results, imaging, department, or nursing in documentation. For example, if I were to click on this patient's lab indicator, this information is going to populate on my right side. It is displayed by date and time. And then once I click on that lab indicator, it is no longer bolded, just as a visual to let me know that I have now viewed that information. At any time, I can still go back into the lab indicator and review that information. Please note, items that are bold or bolded red indicate a critical value or result. So moving back over to the left-hand side of the chart, I would like to review the rounds patients. If I click into this rounds patients, I am going to see any recent lists that I have reviewed. At any time, I can click this show all list and I can review any of the lists that I have access to. For example, if I click on any location and I want to see patients on MedSurg 3, I can do that by clicking on MedSurg 3, and you can now see them on any location, MedSurg 3, and the number listed next to my list just tells me as a provider that there's 13 patients in that location. To navigate back to my rounds list, I can click rounds list, and it takes me back to my rounds list. I'm going to click into the rounds patients once again, and show all list will always show all the lists that you have, but I can also go to my recent list. In this example, I'm going to go to the emergency location, and this allows me to see the patients in the emergency room. Again, it's just telling me the number 8 signifies how many patients are in the ER. I do want to point out that the lab indicator, the bold red, indicates that there's a critical or abnormal lab, and the bold note indicating that I have not viewed any information on this patient. Navigating back to clicking on the emergency location, I'm going to go back to my rounds patients to take me back to my clinical home screen. The next icon is my bill cover or the 2-head icon. By selecting that, I can view the coverage. So if I go to edit coverage, this just tells me as a provider that I belong to the Worcester Hospital group, and I am currently seeing patients associated with these highlighted providers. At any time, I can search for a provider and add a provider to my list if I am covering for another group. By selecting hide coverage, I can now see patients that I am just associated with or I am the attending. Moving back over to the right-hand side of the chart, I'd like to talk about the next two tabs, the Rounding tab and the Sign Out tab. Selecting the Sign Out tab allows me to communicate to others that are associated to my group. Similar to the yellow sticky tab comment, I can make a comment that others in my group can see. For example, I can type in patient ready for discharge. If I can type. This comment is for communication purposes only, and it's not stored as part of the patient's permanent record. And then providers that are associated to my group can see my comment. In this example, because I am part of the hospitalist group, other hospitals can see my sign out comment. So if I am leaving for my shift, then the others can see that sign out comment, and it's just a way of communicating to each other. No, not everybody will use this, but if you are a provider that changes shifts and has others covering for you, this is a handy routine to use. So the Rounding tab, which is next to the Sign Out tab, just allows you to toggle between the two routines. So this just takes you back to your rounds or your clinical home screen. Sliding over to the right-hand side of the chart, we have two items listed here, recently accessed and my workload. Recently accessed are just those patients that I have recently accessed their charts, and I can quickly launch into their chart by just clicking on their name. And as you can tell, the chart button is highlighted, so I'm directly into Gaston's chart. I'm going to close out of that, and it's going to take me back. My workload is equal to the message task system in the current system. You'll notice up above in this black navigation bar, workload is accessible from here as well. It's the same thing. This is just to see while you're on your clinical home screen information that populates here. You will see the same items that you currently see in message task, such as CC'd items, consult, medication renewals, labs, physician query forms, or PQFs. Moving up to the next column, right here, is the Find Patient search bar. Find Patient search bar just allows you to easily search for a patient. You can search by last name, comma, first name, and then you can pick your patient from here. You can further define your search by entering the patient's birth date, age, as well as account number or medical record number. Next to the Find Patient search bar is just a manual refresh. And then I'm going to slide all the way back over to the left and talk about the three-tier icon or the hamburger icon. The three-tier icon allows you to do several different functions. I can select multiple patients. I can add a patient. I can add a patient to the personal list. I can remove a patient. I can print a report. I can restore a removed account, or I can sign up as the attending on a patient. So if I click select multiple patients, just lets me highlight several patients at once. Navigating back up to the three-tier or hamburger icon, I can then sign up as the attending for a patient. The Sign Up button allows me to replace my name as the current provider. And then Replace allows me to assign the provider to someone other than myself. In this example, I am not going to sign up for this patient. I'm going to assign it to somebody else. And then I would click Save. So as you can tell, I have now been replaced as the attending, and then Dr. Keto has now been replaced as the attending for the third patient. Navigating back up to the three-tier icon or the hamburger icon, I can also add a patient to my list. In this example, I'm going to add test Benji, and you're going to get an option to ask what list you would like to add this to. This time I want to add it to all 3 lists because I like to see my patient on all 3, and I'm going to click yes and close out of there. And test Benji is now displayed on my list. Navigating back up to the hamburger icon, I'm going to review now the Report tab. The Report tab just allows me to print a paper report of my patient's list. I'm going to select Worcester Community Hospital and print. And you can print your report from here. This report displays very similar to how it does it currently. And then the last item in my hamburger icon is I can remove a patient. So I've highlighted this patient here, and I'm going to remove the patient. It's going to ask me to confirm removing that patient. I'm going to click yes. And that patient has now been removed from my list. If I did not want to remove that patient from my list, and I say, oh, I want to remove it back or put it back, I can click Restored Removed Account, select my patient that I removed, and easily add that patient back to my list, and that patient now displays back on my list. The next item I'm going to talk about is this black navigation bar. Please note that the black navigation bar stays in place regardless of where you are in the patient's chart. I'm going to go ahead and open up this patient's chart by clicking anywhere on the white area and clicking Chart. And then I'm going to navigate back to the Return To tab. You'll notice on the Return To that you see that I have Nora's Blankenship's chart. Return To allows you to navigate or toggle between different processes. So if I want to go back to my acute status board, I can click the acute status board and it takes me back to my clinical home page or my physician status board. Note that it tells me here with the open chart icon that I do have that chart open. If I navigate back up to the Return To tab, I can click back into Nora's chart easily. I can also close out processes from the Return To. I can close out of Nora's chart by clicking the X here and closing the chart. Best practice indicates at the end of your shift if you close out all processes. I do want to point out that if you use the back arrow, this will completely log you out of Expanse and it will give you a warning. The next button is the Home button. If I am in a patient's chart, I can click the Home button to take me back to my clinical homepage or my physician status board. Yes, alternately, I could have also gone to the Return To and used this acute status board. The next thing is this drop-down arrow. If I use the drop-down arrow, this lets me toggle between the different platforms. If I currently have access to ambulatory or the ED tracker, you can toggle between the different platforms between acute and ambulatory. This is access-based. If you currently do not have access to ambulatory or ED, you will not have access to these platforms. Highlighting a patient in any of the white areas will let you launch into any of these chart functions, such as chart, the documentation routine, order routine, or the discharge plan. Currently, I'm going to highlight this patient and I'm going to click Chart, which will launch me directly into the patient's chart. At this time, I'm going to click Home to take me back to my home screen. And then I want to point out to save a click, if you click directly on the patient's name, it will launch you directly into the patient's chart. Clicking on the Document tab will launch you directly into the documentation routine, as well as the ordering routine. And then finally, the patient's discharge plan. Please note the documentation, ordering, and discharge plan will be gone in further detail during your documentation and ordering trainings. Moving to the next tab in our block navigation bar is the sign queue. The sign queue is equal to the sign queue in the current system. And please note that the number 8 indicates how many items I have pending for signature. By clicking into the sign tab, it launches me into my sign list. The sign list is divided out into orders and documents. Orders, if I want to sign all 6 of my orders at once, I can click the checkbox and you'll notice that a green check displays and I can sign all my orders at one time. If I do not want to sign my orders at one time, I can just click one at a time and sign those orders. I would simply hit submit and sign, and then those 2 items fell off of my sign queue. Please note that in Expanse, we no longer have to fingerprint for non-medication orders or any documents. The only requirements for fingerprint signing is medication orders. So for documents, if I click my documents, I can either use the arrow keys to navigate back and forth on these, or I can just click on them to review them as well before signing. Again, by placing a green check next to the ones I want to sign, I can click submit and I can click sign. So now it displays that I have 5 items for signature. To close out of the sign routine, you would just simply hit close. The next item in my block navigation bar is workload. Again, we talked about workload earlier. Workload equals message task. The number 5 just indicates how many items I have in my workload. Workload is divided into 3 tabs: Workload, Deficiencies, and a More tab. Workload will display any current messages that you currently see in the current system, such as consults, labs, CC items, medication renewals, and physician query forms. Please note that PQFs are listed under Other. I can also do a search in my workloads, such as if I'm looking for a query, I can just type in PQF and I can bring up any of those items using the search bar. To answer a PQF, if I simply click on the physician query and type in my response, I can go ahead and sign. And then once I sign, that PQF will fall off of my queue. And now I only have 4 displaying. The next tab is Deficiencies. In this example, this is an incomplete record, and this is a manual deficiency placed by medical records. This just tells me as a provider that I need to dictate the H&P. Manual deficiencies will not fall off unless medical records manually takes them off. And then the last tab is just for more, where you can view reminders, sent messages, updated messages, or old messages. To close out of the workload, I can simply hit the close button. The menu tab just lets me review preferences, external links. External links allows me to review any external links outside of Meditech, such as the clinical calculator, clinical pharmacology, Expanse provider training, surgical risk calculator. The next icon is the gear icon. 2 items I like to point out in the gear icon is report and issue. At times, if you were called IS Help Desk, they may ask you to report an issue. Report an issue just allows you to take a snapshot of your screen. The other item I'd like to point out is Suspend. Suspend allows you to suspend your session. To go back and to resume your session, you would just click Resume and it will take you back into your session. When using Suspend, if you are in the documentation or ordering routine, it will place a lock on the patient's chart. Others will not be able to get into the system because of the lock, because the system thinks that you are placing orders or documenting. So I do caution using Suspend and to not use it when you are in the documentation or ordering routine. And then the close button will just close out of any current process that you are in. So at this time, I'm going to launch directly into a patient's chart. I'm going to click on the patient's name directly. And we're going to just go over some to get you oriented to this screen. So at the top, the patient's chart tabs display. Your home page when opening the patient's chart is the summary page. Moving over to the right-hand side of the chart is what's called the reference panel. The reference panel displays no matter what chart tab you are reviewing. For example, if I jump to Diagnostics tab and to review any lab data, this reference panel will stay in place regardless of where I'm at in the patient's chart. If I jump to Provider Notes to view physician documentation, again, that reference panel stays in place. On the patient's reference panel, we have what's called the patient header. The patient header displays the patient's name, age, sex, date of birth, and medical record number. Next to the patient header is a blue head icon, which just lets you know that the patient is rolled into the patient portal. It will be gray if the patient is not enrolled in the patient portal. Underneath the patient header is the patient's admit status and patient location, followed by height and weight and account number, code status. Left clicking on the account number will display patient visits. For those pediatric hospitalists who use the baby link, your baby link or the link to mom's chart will be displayed here. So it looks very similar to current system. If I left click on the code status, I can quickly launch into the code status and change code status on the fly. To close out of this screen, you would simply click the red X. The search chart feature is what is called Googling the chart. I can quickly look for items within the patient's chart. For example, if I want to view x-rays, I can type in x-ray and it will search the chart for any x-rays that have been completed on the patient. In this example, all the x-rays are displaying, and if I want to view just the PA and laterals, it will now display the PA and laterals, and I can view the report. Underneath the search chart function is I can collapse these items, which are called widgets. Widgets are just blocks of information, and they are also found elsewhere in the chart. So each of these are a widget. I have a problem widget, allergy widget, vital sign widget, medication, home med widget. This just allows me to expand the widgets, and then I can expand them here as well. Under medications is the prescription monitoring program. This will launch the ORS report. It's displayed under medications as well as home meds. When you open up a patient's chart, your landing page is the summary page. The summary page is composed of widgets as well. It has a column to the left and a column to the right. Again, each of these items are widgets: vital signs, personal notes, patient demographics, assessment reports. One nice new feature in Expanse is these are customized to you as a provider. By navigating to the gear icon, I can search the reference panel widgets, which is over here on the right, and I can change the order to these. If I want to view home meds first, I can move these up to the top, and I can move my outstanding orders up, or I can move them down. I can also add a widget here if I would like. So I want to view diabetes results on my reference panel because to me as a provider, it's important that I review the diabetic information. And now it's displaying here. And I want to move this up, and I want to move my cardiac studies up. I can do that. So I can move these up or down to whatever order I feel I would like to view these in. I can save that. And then now these are viewed in the order that I picked them in. Going back up to the gear icon and navigating to my summary preferences, I can do that with this summary page as well. I can move widgets up and down. I can move them right and left. And I can also add a new widget. And now I have added the obesity lab values. I can also rename a widget. If I don't like a name of a widget, I can just type in a new name and rename it. So again, within the widget preferences, I can add new widgets to my right and left column. I can move these back and forth to customize this to my specialty. The next column within a patient's chart is the Activity tab. The Activity tab tells a chronological order of the patient's story. It is displayed by date, and this information is found elsewhere within the patient chart. The next icon, or chart tab, is the flow sheets. Flow sheet equals clinical panel in the current system. Right now I'm reviewing the hospitalist clinical panel, and I'm defaulting to every 12 hours. I can change this to view at 24 hours, 12 hours, 4 hours, and so forth. I can also change my flow sheet to other flow sheets that are available. Again, these flow sheets have not changed from the current system. They have just named them flow sheets instead of clinical panels. So I'm going to just switch this to adult clinical panel, and you can favorite an item by using the yellow star. Again, this information is just displayed in a flow sheet view. The next chart tab is Health Management. Health Management is just maintenance protocols, health maintenance protocols, mostly done on the ambulatory side, such as colonoscopies, yearly mammograms. This information will be displayed so you can view it as well on the acute side. Moving back up, we have the History and Problems tab. You can view the History Problems tab from here as well as edit the History and Problems. History and problems is going to be covered in your documentation training in greater detail. The next chart tab is the Administrative tab. This is just all your patient registration data, which includes your demographic page, guarantor, contacts, insurance information, legal information, appointments, and any history on the patient. Other clinical tab is probably a tab that you won't be going to very often, but I would like you to be aware of what information you can find in the other clinical tab. This information is found elsewhere in the patient's chart as well, such as allergies, members of the care team. But there is a lot of information here, such as blood bank summary, codes that have been used, forms, goals and barriers, health maintenance, substance use, immunizations, implantable surgical devices, letters, medical summary, the oncology treatment plan if applicable. Workload items are also listed here. Order list, patient education, patient pharmacy, personal notes, referrals, special indicators, surgeries, and patient-generated data. So lots of information in the other clinical tab, which can also be found elsewhere in the patient's chart. Moving back up to the Diagnostic Chart tab, this just allows me to view any diagnostics on my patient, and it is categorized into labs. You can further define coags, chemistry, and urine here. As far as imaging, I do want to point out in our test system, we don't have the interface for the actual image, but it will be a pair of lungs and it'll launch into PACS like it currently does. And then you can also view the report as well. And then we have our micro results, pathology, blood banks, and cardiovascular. We do have a filter overlay, which you can further define and filter your search results, such as care setting, time frame, and subcategory. So in this example, if I just want to see my inpatient for 1 year and apply that, it'll show me that patient information displayed. Provider notes allows me to view any physician documentation. Clicking on the report icon, I can view the report. And then once I'm in the report icon, I can scroll through the other provider notes. I can also click on them as well, or use the up and down arrows. By left clicking on the document type, such as the history and physical, I can view all the history and physicals associated to that patient. I can do that for any document type, such as the hospice progress note as well. The next chart tab is the Nurse Allied Health tab. The Nurse Allied Health tab will show me my nursing documentation, as well as social work, case management, and hospital chaplain documentation. To view these items, I can simply click on it to view any item and view the detail or history. And I can also filter any of this information as well by care setting, time frame, specialty, and subcategory. The last column is the Medications tab. This allows me to view any current medications on my patient. I also have this Current Visit tab, which will further define. I can view current infusion titration items, home medications, MAR, medication snapshot, and visit snapshot. One last thing I'd like to show you is in the menu bar, we have what's called Chart Viewer. Chart Viewer allows you to view 2 sessions of your Meditext. You can work in one browser tab while viewing in another browser tab. So as you can see, I have 2 browser tabs open now. And if I have a second monitor, I can just drag this session to my second monitor. So you can tell I'm in Chart Viewer because it says Chart Viewer. Within Chart Viewer, I can place orders and I can view the chart. So since I am working on one monitor, I can still show you how this works. So I'm going to drag this session over here. And view my chart viewer over here. So I have my session over here and I have my chart viewer over here. So for example, if I were documenting a note, I could go to my document routine and I could view my diagnostics while I am documenting a note to refer back to. If I'm in the documentation routine and I'm documenting a note and I say, oh, I should have ordered blood work for the morning, I can go ahead and order that without ever leaving my document. So Chart Viewer will allow me to place orders and I can view the chart. Now, if I am going to log out of this patient's chart and I'm going to go home because I got a phone call and I need to go look at a different patient, Chart Viewer will close out and it will follow me. So now I'm on this patient's chart, and so Chart Viewer will follow me from patient to patient. So this is a helpful tool that I can use 2 sessions to view. To close out of Chart Viewer, I would simply hit the close button. This concludes our walkthrough through navigation. Thank you.